Ambulance services are struggling to keep up with phone calls because they're not getting paid. I'm Caleb Aguayo, and I'll show you why that has administrators in one West Alabama community calling 911 calls a necessary evil. Those sounds mean help is on the way, and it also means someone has to pay for it. For the Greene County E.M.S, there's not enough money to always pay for the services their medical responders provide.
We don't make money off 911 calls. Not as sad as it is. The reality is that 911 calls are a necessary evil.
The Greene County E.M.S is the only ambulance service in the region, and Director Chris Jones says it loses about $20,000 per month because of no consistent payment for its services.
Everything has gone up except for what we're paid for our service, which has stayed the same.
The funding concerns are also a problem in nearby Tuscaloosa. North Star E.M.S manager Edgar Calloway says costs for medical transport services just keep growing.
There's been no change, really, in what we were paid in 2020 and what we're paid today. So we've got a minimum of a 40% increase in cost with like maybe a 10% increase in reimbursement. So it's not just a problem in the rural areas, it's a problem nationwide.
Greene County's situation is different from most because bingo charity halls are allowed to operate due to a legal loophole in Alabama's gambling laws. The sheriff collects revenue from the halls to fund county services like the hospital and fire department. However, E.M.S Director Chris Jones says that revenue doesn't include emergency medical transport services. Their only funds come from a property tax set in 1983 and as gifts from the nearby towns of Utah, Union, and Bolagie.
A gallon of milk don't cost the same as it did in 1983. The cost of running an ambulance service is astronomical now, but they're still paying us the same.
And an ambulance can cost quite a bit of money. Between the cardiac monitor, the gurney, and the medicines, the cost of equipment is roughly $100,000. Advanced emergency medical technician James Hanna says those basic costs for the service hurt the ambulance agency's bottom line.
It's really taking a toll on especially rural EMS because we have to make payroll, we have to do payments, in which another thing we do to help with that is we do non-emergent types transports.
When it comes to transporting a patient, insurances don't cover the full cost, and 14% of people in Greene County are reported to not have health insurance. So, ambulance services are forced to resort to other methods of funding. Utah Mayor Latasha Johnson says the E.M.S board wants a greater county tax to support ambulance services.
We have spoken about, when you say going up on your taxes, people get alarmed, get upset, you know how that is. So we are exploring options.
Greene County commissioners say a greater property tax just isn't feasible at this time, but Chris Jones says he won't give up trying. He will keep the discussion alive and will try to find other funding in the meantime. For the University of Alabama, I'm Caleb Aguayo reporting.